In terms of questions, I'm sure that lots of you have got questions, which is why you've joined us today. If you can use the chat function to ask those questions, because it may be that actually as we go through the presentation, your questions get answered. But what we can do is Indy and Jazz, who are from the local authority, they're going to sort of summarise some of the questions because there might be similar themes. And then we can have a bit of a Q&A at the end. OK, so this is just us. So things that we're going to talk through is just a bit about coronavirus and the disease that's caused by the coronavirus, which is COVID-19, how the disease presents and spreads, how to stop the spread of disease using some infection control precautions, how to prepare with and deal with a single case of COVID-19 in a school, and that could be a school, early years, or other sort of educational or childcare establishments. So when we say school, we're referring to the sort of wider context in terms of anything to do with children's settings. Then also how to manage an outbreak of COVID within a school. So as we say, things are rapidly evolving, so do access the current up-to-date guidance, anything that's underlined or hyperlinked so that you can click and go straight through to the most recent guidance that would be appropriate for your setting. So coronaviruses are a family of viruses, and there's all different sorts. So the mild one that most of us will have experienced is the common cold. But it can also cause severe disease. So the two that we've had previously is severe acute respiratory syndrome, or SARS, that some of you might remember was around in sort of 2002. We've not had any cases since 2004. So for 16 years, there's not been any cases of SARS. Then we've also got Middle East Respiratory Syndrome, or MERS, and that's been sporadic since 2012. And both of those are really severe diseases. And then, of course, we've got the new disease. So this is COVID-19, and it's caused by the SARS-CoV-2 virus. This is a brand new virus. So before sort of December last year, it just didn't exist in people. And that means that there's no population immunity. So everybody is potentially susceptible. I can just see that we have got somebody who's got the hand up. Did you want to come in? Or maybe not. OK. That's what it looks like under microscope. The reason it's called coronavirus is because it's got these little dots around the outside, and apparently it looks like a crown. So corona crown. And this is what usually happens for the majority of people. So when we get exposed to a virus or a disease, we often don't get symptoms straight away. We have what's called an incubation period. So that's where the virus is multiplying in our body, but we feel absolutely fine. We're still going to school or work or shopping or whatever we need to do. And then we develop symptoms. And so that incubation period is usually sort of 4 to 6 days, but it can be up to 14 days. So you could be exposed to the virus and only develop symptoms 2 weeks later. Obviously, once you've got symptoms, then you know that you're ill and you're potentially infectious to other people. One of the concerns with COVID is that you're infectious for a couple of days before you start having symptoms. So whenever we pick up a case, it means we have to look what have they been doing the 48 hours before they've become ill. And I say that's really, really difficult because at that point you feel fine. You don't know that you're ill. For most people, the illness lasts sort of 7 to 10 days. And then once you're feeling better, you've not had a fever for 2 days or so, then you can come out of isolation. So that's the typical course of the illness in the majority of people. And certainly in children, we tend to see that people have got very, very mild symptoms. In some adults, though, you know, they get to the sort of 10 days and actually they start to feel worse rather than better. And those are the individuals that potentially could end up in hospital. So as we say, the incubation period is the time between your initial contact with the disease and the appearance of the first signs or symptoms, usually 4 to 6 days, but it can be up to 2 weeks. The infectious period is when you might sort of infect other people. So when you're actually at risk of spreading the virus from you to other people. And as we say, that can begin a couple of days before symptoms appear. Usually it lasts around 7 days from the onset of symptoms. So sorts of typical symptoms that we see. Most people, almost sort of 9 in 10 people, will have fever, and that is something above 37.8, and a new and persistent cough. Other things that have been added to the case definition is a loss or change in taste and smell, and that's quite specific. It's something that some people mistake for being hay fever. As you can see, a lot of people are also just really sort of tired, achy, flu-like symptoms. But in children, symptoms may be really mild or non-specific. So, for example, children are more likely to have sort of gastrointestinal symptoms. Having said that, any of you particularly that work in sort of early years and primary will know small children often have a lot of illnesses because it's the first time they're coming across these viruses. So, you know, if a child goes home because perhaps they vomited, that doesn't necessarily mean that they've got COVID, and they may not be advised to have a test. But certainly if they vomit and they've got a fever, then they fit the case definition, and we would suggest that they get tested. So as we say, just because we've got COVID doesn't mean that lots of other childhood illnesses like chickenpox or norovirus have stopped. You know, we still need to exclude children from school if they're poorly anyway, but these are the sorts of things that we might be looking at, as particularly cough and a fever, and again the impact on the sort of sense of taste or smell. So the disease spreads in droplets. So if you breathe on a surface, you know, like if it's really cold and you breathe on a window, you can see all the droplets from your breath on the window, and that's how this disease is spreading between people. So it can particularly be spread when we cough or sneeze or sing, or when we talk to other people. But also when we're breathing, those droplets settle out onto surfaces around us. So sort of, you know, desks, stationery, books. If we think about wider settings, things like trolley handles and so on in the supermarkets. And so while we can breathe them in directly from the air, we can also pick them up from contact with surfaces. And of course, the issue with that is we touch a surface, for example, a desk, and then people, you know, either eat something without washing their hands, or they rub their eyes or put their fingers in the mouth. And again, particularly looking at our younger children, you know, we know if they're anything like mine, they've sort of got a finger up the nose, and then they're scratching their bum, and then they're hugging their friends. And it's so easy for these sort of viruses to spread in that sort of setting. So obviously the concern in schools, there's two sort of big concerns. One is just the fact that you're close to children and young people and close to each other, and therefore you could be exposed to respiratory droplets. If we think, though, of some of our particularly vulnerable children, some of them might be at special needs school, but some may be mainstream, those who require certain medical procedures that we call aerosol generating procedures. So, for example, children that have a tracheotomy, or who require suctioning, or potentially children that have habits such as spitting, might be at an increased, you know, there might be an increased risk of transmission from those young people. As we say, in terms of the environment, on some hard surfaces, the virus could survive up to 9 days. Most of the time it's around 48 hours, but it depends on a lot of things like humidity and if it's inside or outside and what the sort of surface is. But it's easily killed on surfaces using bleach containing solutions and standard detergents. And it's also easily killed by hand washing with soap and water, or by using alcohol-based gels on clean hands. You can't use alcohol gels as a way of sort of getting out of washing your hands. Your hands do need to be clean before you use them to be effective. So if anybody has symptoms or has a positive test, they are required to stay home. Oh, sorry. I don't know if that was me or somebody else. Seems to have stopped. Okay. So if somebody is positive or symptomatic, they're required to stay at home for at least 7 days. And that's to you know, get to the end of the period where you might be infectious to others. However, if you've still got severe symptoms. So if people still feel really poorly, particularly if they've still got a fever, then that isolation might need to last for longer. For households, household members of anybody with symptoms also need to isolate, and that's for 14 days. And if we think back to that incubation period, it's to ensure that any of the household members that are potentially incubating COVID aren't out in the community or at work or school and potentially spreading it to other people. We also now identify any of what we call close contacts of confirmed cases, which I will discuss a little later, and they are also advised to isolate for 14 days, and that's 14 days from the last contact with the person who's got the confirmed case. So there's sorts of things that help. They can see bubbles. So what we want to do is reduce the spread of COVID, both in our day-to-day lives and of course for everybody within the school setting. So most schools have introduced bubbles so that both teachers and teaching support staff and children, young people all stay with the same group of people throughout the school day. So from when they come into school, at lunch times, at play times, and when they go home. And that's really good because that reduces the opportunity for the virus to spread. And if we do get somebody who's a confirmed case, it means we can easily identify who their contacts are. It's also important, though, to minimise mixing. Oh, am I echoing a little bit again? Oh, not sure. OK. It's really important to minimise any sort of mixing within groups within the school setting. So thinking about any clubs that are running before lunchtime, after school clubs. Things like your drop off and pick up times, when you can get a lot of people congregating around the school gates, and again things like lunch times and play times. And also think about this in terms of any staff that may move between different bubbles. So if you have staff that are maybe supporting a variety of different young people or children, or cleaning staff that again might move all around the school, and particularly senior staff, if one of those ends up becoming a confirmed case, it can mean an awful lot of close contacts within the school setting. Respiratory hygiene is really important, and for most of us as adults that might be quite easy, but again for our younger children and anyone with special needs, we might need to actually support them in terms of the sort of catch it, bin it, kill it, but making sure we've got disposable tissues available, we've got particularly lidded bins are always helpful, and then we wash our hands after we cough or sneeze. And again, if we're going to cough or sneeze, cough or sneeze into a tissue. If there isn't a tissue, try and use your sort of elbow rather than your hands to cough or sneeze into. And again, hand washing is really, really important. Also reduces the spread of other infections. So in Australia, it's currently Australia's flu season, and they have had very, very few cases of flu because everybody is being so careful at the moment with their social distancing and with their hand washing. So it's worthwhile if you've got hot water. The reason being, it's not so much that if you've got warm water, it kills the germs more, but warm water means that people are more likely to wash their hands for the required amount of time. You need to make sure you've got liquid soap available and paper towels for both adults and children to dry their hands on. And many schools have introduced hand washing as part of the routine of the school day, that as soon as people come in, they wash their hands, and before you go, if you come in from playtime, you wash your hands, and before lunch you wash your hands. And again, for our younger children and for people living with special needs, they might need to have supervised or supported hand washing. So personal protective equipment, of course, there's been a lot about this in the media in terms of care homes. PPE isn't required in most educational settings. But you may need to think that there's a couple of exceptions to that. So if you already give personal care to children and already use PPE, then obviously continue to use that. If any children or young people are undergoing these aerosol generating procedures, then again, you might need to think how that is done to protect both the people undertaking the procedure and also the rest of the class. So, for example, if a child has a tracheostomy, there might need to be a specific room they go to have their suctioning care undertaken. And then the room closed, and then obviously that room then needs to be cleaned before they go back. The other purpose of PPE is to protect any staff that need to care for someone who's got symptoms and can't maintain 2 meters distance. So if a child or young person or an adult becomes symptomatic, obviously they need to go home as soon as possible. But if they require somebody to care for them, again, because they're very young or they feel very ill or they've got a special need, then we'd suggest that staff, use things like masks and PPE to protect themselves from infection. And there's a really useful video for staff because in order to be effective, personal protective equipment needs to be both put on and removed in a certain way. So again, there is advice around cleaning in non-clinical settings. So detergents can be effective in terms of cleaning, but if anybody has been symptomatic or you've got a confirmed case at the school, then consider a combined detergent and disinfectant. And we recommend chlorine-based disinfectants because they are known to be effective against COVID. Of course, cleaners, need to wear gloves and aprons. And again, if there's been somebody that we think might be infectious, then they might want to think about a mask and possibly eye protection if there could be any, sort of splashback or spills while they're cleaning surfaces. So sorts of things that can be helpful, and of course now we're starting to think about September. Ensure that staff and parents are aware that they should be isolated at home if they're symptomatic or if anyone in their household is symptomatic. We seem to have picked up an awful lot of people continuing to go into schools while they have temperatures or while they have a cough, or while they've got any other sorts of symptoms. So I know one that we spoke about had actually lost their sense of taste and smell. They'd been quite short of breath, but they didn't think that it was COVID. So again, messages to both staff and parents: if you think you're unwell, please stay at home. Ensure that all your staff are aware of the infection prevention and control measures. So what have you put in place at the school so that they can support that? Supporting children, young people with both the hand hygiene and respiratory hygiene, and ensuring that you've got appropriate supplies. So as we said, things like tissues, liquid soap, paper towels, appropriate cleaning materials for surfaces, and a lidded waste bin. You need to ensure that PPE is available and that staff know where to access it for if anybody does become unwell. And again, we think about children, young people, but it could actually be a staff member that suddenly becomes really unwell. Ensure that you've got appropriate cleaning. Oh, somebody else got control of the slides. That's really confused me. Yeah, ensure that you've got appropriate environmental cleaning systems and waste disposal. So again, if there's somebody who is symptomatic in school, there's particular guidance about what you need to do with sort of any tissues, paper towels, those sorts of things. And think about where you could isolate somebody if a member of staff or a pupil became symptomatic while in the setting. So I know in my children's schools, I don't live in Birmingham, it's often sort of opposite the office, right in the entrance, where children wait to be picked up if they're sick. But of course, everybody's walking past there, so there's lots of contact, and it's carpeted. So if children are sick, it's really, really difficult to clean. So do have a think where an appropriate place might be that you could isolate staff or pupils if they became ill within the setting whilst you're waiting for somebody to take them home. So some definitions. So we talk about people who've got symptoms or who've got COVID as a case. And a confirmed case is somebody who's got a lab test positive case of COVID. They may have symptoms, but there's an awful lot of asymptomatic carriage. Sorry, now I'm just about to start coughing. I don't think I've got COVID, but I'm starting to cough. Okay, and then our other case definition is somebody who's a possible case. So this is somebody who's got these sorts of symptoms, but we've not yet had a lab test back on. So they're a possible case. And then we talk about contacts. So these are people who may have had contact with the case while they're infectious. So these are the people we're talking about that potentially could be in that incubation period. So we talk about direct close contacts. So those are people that are face-to-face with somebody for any length of time within 1 metre. They might have had a face-to-face conversation. They might have needed to touch each other, or they might have been coughed on, or you know, in some of the SEN settings, they might have been spat at. We also think of contacts as being anybody who is within 2 metres for more than 15 minutes. So thinking about the bubbles that you have in your settings, that would generally include the whole bubble, both sort of staff and students, or anybody who's travelled in a small vehicle with a case. So again, you might be thinking about your transport in terms of SEN settings, but you might also think about whether staff are lift sharing into work, and what would the impact be if one of those became a confirmed case. So if we think about a single suspected case, so this is a pupil, you know, a child or a member of staff that has got symptoms. So they need to self-isolate for 7 days from the onset of symptoms. If they're okay on day 8, if they've had no fever and they're fully recovered, then they can return to school on day 8. But their household members need to self-isolate for 14 days from the onset of their symptoms. So if you think if this was, you know, a sort of foundation stage child, actually they couldn't come back to school on day 8 unless somebody else can pick them up and take them, because you know, their household need to stay isolated. We do need to help the case to get tested. So if it's staff, we can request that via the key worker testing portal. And if it's children or young people, again, they can get home testing kits. The downside of the home testing kits is the parents have got to be confident enough to take the test, and they can also take some time. So again, we'd look at things like sort of drive-through settings, or if parents don't drive, the local system. So we can support children, young people to get tested in the community, potentially at their home. So the only actions for the school in that case would say, you know, make sure they're isolated, help them to be tested, and then protect the school community. So for a suspected case, we don't isolate any other pupils or staff that have had contact unless they're, for example, siblings. But we do ask that environmental cleaning is in place and start thinking about, could you identify the contacts of this person if they did come back as a confirmed case? So if, for example, it's a staff member, you might be thinking, OK, I know they're in that bubble, but I think they also helped out in another room and maybe they had a meeting with some staff. So just start trying to think about if you could identify their contacts. If you have a confirmed case, so again, that person should not come to the school for the 7 days, and they shouldn't come back until, you know, they're well and they've not had a fever. And again, household members should be isolated for 14 days. But for confirmed cases, we now need to do contact tracing. So that means we have to look at actually when was the person last within the school setting, and was this within the infectious period? So that infectious period, again, remember, is a couple of days before they start to get symptoms or a couple of days before they're tested. And again, we want to ensure that we've got our environmental cleaning in place, but for a confirmed case, all close contacts of the case will need to isolate for 14 days. So, you know, if that's the bubble, it could be the whole bubble. But again, we might need to look at things like school transport. If it's a staff member, have they had meetings with any other staff? Do they travel to work with any other staff member? So that's where we need your support really to do that contact tracing and to isolate people for the 14 days. Now, an outbreak is 2 or more suspected or confirmed cases of COVID amongst students or staff who are direct contacts. So when we talk about a cohort, it could be 2 or more suspected or confirmed cases within quite a small school or nursery or childcare setting. If we're looking at something like a very large high school, it could be 2 or more cases that were within the same sort of class or the same year group, or, you know, within the same football team. So we sort of need to look at, you know, how do these cases relate to each other? And if an outbreak is suspected, so for anybody who's got symptoms or a positive test, make sure they go home safely. Obviously, if they become extremely unwell, call 999, but make sure that the ambulance knows that there's a potential outbreak. You must inform us of an outbreak, so we're Public Health England Health Protection Team, and you can either phone us or there is an electronic survey, and we will start to establish key details and might set up an incident management team meeting called an IMT. Those are always done remotely, so we tend to do them by teleconference. And really the point of that is to ensure that everybody involved, so that could be the local authority, us, the school, the academy chain, and anybody else who needs to be involved, have got a really clear oversight of exactly what the situation is within the school. We might decide then to undertake further testing, and we might decide that further individuals need to be excluded. But again, that would be a sort of system discussion between us, the local authority, the school, and any other agencies that are involved. So things that we're really concerned about is if tragically, somebody has passed away due to COVID in the setting. If there's a large number of vulnerable children, so again, if we're looking at an SEN setting, we may want to have an IMT. If we've got a large number of cases, if, despite usual control measures, actually you're continuing to get new cases, we'd really want to be looking at exactly what was going on there. If there's concerns about the safe running of the school, so for example, in other areas, we have had some school staff that have reported they've been told to go into work, even though a family member's a confirmed case. So, if there's any concerns about people's understanding of guidance, we might want to get involved. Or again, if there's any other factors that mean that we need a multi-agency coordination and decision making. And again, this isn't all PHE or the council making decisions. This is us as a group deciding what we need to do, obviously to protect the staff and the young people in the setting. And then we've got some details of useful resources. So again, you've probably been overwhelmed with the amount of things that have come out for the Department for Education, but really key things are this sort of guidance for schools, implementing protective measures, and the cleaning in non-healthcare settings are really important. And again, this is some things that PHE South East developed. So again, these are meant for schools, and these are videos, and kindly they've done them with music or without music because background music sort of irritates some people. And again, those are free to watch or to share. And just some thanks, because this presentation was based on obviously a lot of other people's work as well as our own. So I think, shall we go to Indian jazz and have a look at actually what sort of questions have we got, what themes then have we got from our questions?
Okay, so I've got echo as well now, so I don't know what's going on. Can everybody hear me okay? Yeah. So there was a question about masks for special needs schools. The advice is a fluid repellent surgical mask that should be used. There was a question about cleaning products. I think there's a question about kind of chlorine use can be irritating to some people. It's just important to remember that the dilution is advised to be 1,000 parts per million. So please do check that you are diluting it correctly as well. Milton is quite safe to use around children and pets as well, so quite safe to use in schools. But if you don't want to use chlorine, then we'd advise EN standard 14476 for virucidal activity. I think that was a couple of questions that I picked up.
Okay, Indy, which questions have you picked up?
Right, we've got a couple of questions about alcohol-based gels as to whether they're effective as hand washing, and also whether they could use hand gels for some parts of the day and hand washing with soap and water. There are further issues about hand washing as to whether antibacterial bar soaps can be used in addition to liquid soap, and whether hand dryers can be used. Obviously, you've covered paper towels being used in the toilet areas.
Okay, so the reason why we recommend paper towels is that with hand dryers, what tends to happen is people don't stand long enough to dry their hands, and wet hands will cause more multiplication of viruses and bacteria. So paper towels are more effective because people will dry their hands a lot better. What happens with hand dryers is that people tend to wipe their hands on their trousers or around the hip area. So basically you've contaminated your hands after washing them. So that's why it's kind of not recommended. The bar soap we do not recommend use of. Just normal soap and warm water will do the trick. You're just basically washing off anything that's on your hand, and it's important that the children, staff follow the right technique, wash their hands for 20 seconds. Alcohol gel is effective against the coronavirus virus, but it mustn't replace hand hygiene. If there's no sink in the vicinity, then yes, you can use the alcohol, or hand sanitizers can be used. But in situations where, for example, now we're going into September, there's going to be a lot of tummy bugs and things, we don't recommend using alcohol gel in those situations. And alcohol gel should only be used on clean hands, because dirty hands, it won't be effective. It won't actually break down any dirt on the hands. So not to replace it for good hand washing, but yes, it can be used if there's no sink there, but try to encourage hand washing with soap and water more so.
Right, we've got a few more questions about symptomatic children and whether if their parents refuse to get their child tested, what can the school do?
Oh, really good question. Okay, so we can't force people to get tested. We'd offer testing to anybody who'd got symptoms. So if they don't want to have their child tested, we just have to continue with the same isolation advice. So at least 7 days for the child that's symptomatic and 14 days for the rest of the family. Now, if the child is tested and is negative and becomes asymptomatic, then actually the child can come back to school and the parents can get on with their lives. But should they choose not to have the child tested, then we have to assume that they're positive. And therefore it's 7 days for the child and 14 days for the household.
And Angela, if we can follow that up with, if a child has been tested positive, how long, obviously you've covered how long they need to be off. However, will this start from the onset of symptoms or from the date of the test?
Yeah, so for somebody that's symptomatic, it's from the start of the symptoms. If people are asymptomatic, then we take it from the date of the test.
Right, and if anybody develops symptoms, do they contact PHE, or is it only if there's a confirmed test result?
A confirmed case. So for schools, yeah, if you've got children or staff that you think meet the case definition of COVID, so you know they've got a temperature, or they're coughing, or they're short of breath, or they're reporting a loss of sense of taste or smell, then please do report it to us, because if we want to know, and we can give the school obviously guidance and advice about what to do, but also if there is any concerns with getting a child tested. So for example, one school that we've worked with, they're quite a distance from the testing site. Most parents don't drive, so the team have actually been out and tested children at home. So we can support the testing if that's needed, so please do let us know.
Right, Angela, we've got another question here. Obviously, if a bubble has to isolate for 14 days and the actual positive confirmed case is for 7 days, what happens if obviously the child wants to come back after the 7-day isolation is over and they are feeling better?
Yeah, and these are where we get into those sort of really practical issues. Like we've said, in some circumstances the child could come back to school, but the household have got to isolate. There's nobody to bring them. So I think obviously the decision would be up to the school, but what you might want to do is say actually everybody in that bubble is now off for 14 days. The guidance that we're using is just the sort of minimum of 7 days. It may not be appropriate to sort of introduce that child into a different bubble, while they're waiting for the rest of their classmates to return to work.
We've got another question about if a family refuses to test a child, does the bubble need to isolate if we are assuming they are positive?
Yeah, so no, we only do that on confirmed cases. So whilst we always encourage the household to isolate for even suspected cases, in terms of contact tracing and further exclusions, we only do that for confirmed cases. So that's why we really encourage people to get tested. So, you know, so that we know one way or the other whether or not their bubble needs to isolate.
And what advice would you give for physical contact with SEN children and staff?
Oh, okay, that's a really good one. Obviously, some of our SEN children need to, you know, they need personal care. So they might need care with sort of their continence, their movement and so on. In which case, you know, we still need to care for those children as we would. You know, if you normally use things like gloves and aprons, then use gloves and aprons. Obviously, it does mean that because you're having such close physical contact with those children, I think the same for our sort of very early years and preschool settings, it does mean there's likely to be more close contacts. So, you know, really reinforce the use of your bubbles so that if anybody does come back as positive, we know exactly who we need to isolate.
Okay, we've got a question about fans and also heating. Can we use heating? And obviously, if it's a hot day, are we able to use fans?
Okay, I'll pass that one over to Jazz.
In certain settings, we wouldn't advise fans, for example, in a clinical setting, but we have asked this question because with care homes as well, and we've been told that it's okay to use, but what we would highly recommend is to have the rooms well ventilated, so having the windows open so that there's fresh air and the air's being circulated. So yeah, I mean, we've been told yes, fans are okay, but I know in clinical settings we say no.
Yeah, but certainly having the windows open can be really helpful because it improves sort of airflow through the room, which means that any virus isn't likely to stay around as long.
We've got a question about risk assessing staff and pupils due to pre-existing medical conditions and treatments. If they are vulnerable, what measures can we take to bring them back into school?
Oh, okay, so that's a good one. So it depends on the sort of level of vulnerability. So we've got some people that are considered sort of vulnerable, and some of those will have been shielding, and there may now be a decision to bring those members of staff back into school. People who are shielding, so those who are extremely vulnerable, which means those that are maybe on chemotherapy or immunosuppressive treatments. The guidance is still that I think that's being paused on the 1st of August. So by September, depending on the local situation, most people should be able to restart work. However, you would need to do an individual risk assessment, probably with their doctor, you know, so get something from their doctor saying yes, they can come back to work, or yes, they can come back to work, but actually they need to still be able to stay quite isolated and not have contact with a lot of people. Generally, the community spread of COVID is now quite low, but obviously we've seen from the case of Leicester that, you know, it could go up again. So it's still really important to protect, you know, our most vulnerable pupils and staff. In terms of the children, there's been a bit of a debate between, you know, very vulnerable children, so those who are having things like chemotherapy or immunosuppressed, cardiac disease and so on. There's a bit of a balancing act between potential risk from COVID infection, which at the moment seems to be very small. Even those very, very vulnerable children generally seem to have quite mild symptoms. So speaking to the team at Birmingham Children's Hospital, they've had children sort of with leukemia who've had bone marrow transplants that have got COVID, and they've actually coped really well, which is such good news. So, you know, it's balancing a potential risk to those children of actually the risk on their emotional and social well-being of being off school for a very long time. So most doctors are now saying, yes, these children can go back to school. It's a little more tricky with the staff, particularly thinking of staff that are older. staff from the BA/ME communities, and staff that have underlying cardiovascular conditions and things like diabetes might be at higher risk. So, you know, you might want to think about the roles that they have. So, for example, in an SEN setting, you might want to avoid placing staff that will be particularly at risk with children who do spit. You know, who maybe have, you know, much more challenging behaviour and therefore need a lot more sort of physical interaction. But that is going to be an individual risk assessment for the schools to do.
Right, we've got a question about using shared equipment and what the guidance is based on, obviously, pupils sharing the same equipment, such as tennis paddles or science lab equipment.
So I would say for most equipment, it should be okay to use the advice in using a chlorine-based cleaner, but with things that you can't, then you need to follow the manufacturer guidelines really for cleaning. And the important thing is try not to use as much as possible items that can't be cleaned effectively. But if it is that it's not possible to do that, then it's that good hand hygiene and making children are washing their hands with soap and water, so that then to advise them not to touch their eyes, nose and mouth, but as much as possible not to be using equipment that can't be cleaned, either using the chlorine-based solution or by following manufacturer guidelines for cleaning. That's the other important thing as well.
And how about having a clutter-free classroom in order?
Oh, very important. Yes, very important. I think what we've got to remember is that if there's a lot of clutter, at the end of the day, when the cleaners come, it's very difficult for them to be cleaning surfaces that are cluttered. So it's I know it's difficult in a school setting, and you know there's a lot going on, but particularly at the end of the day, so the cleaners can clean all the surfaces to put all that clutter away, so that cleaning can be done effectively.
Right, we've got a few more questions about heating and whether we can use air conditioning in classrooms.
I don't think there's any issues, Angela, with using air conditioning in the classrooms.
No.
I think there's no issues there.
Again, it's one of the questions that we've asked our head office, and they've said as long as it's properly maintained, that's not an issue.
Right, we've got a question for early years settings. They are asking what continuous provisions look like in early year settings and what equipment can be used to play with.
Okay, so you particularly want things that can be cleaned easily. So I've known some early years settings have done things like, if they've got, for example, blocks, they've put the wooden blocks away for the moment and they're just using more sorts of things like mega blocks, those sorts of things, and then at the end of the day it all goes in a sort of Milton solution overnight and then gets dried the next morning. Particular things that we'd be concerned about is, for example, if you've got babies in, you know, like sort of bouncy chairs, obviously you need to wash them at the end of every day, because babies generally sort of slobber and vomit and all sorts, don't they? And the same with mats. Make sure people have got their own mats and that they're washed regularly. Playthings that can be a risk is things like sand pits, there's sort of water bubbles, and things like Play-Doh. So the sorts of things that everybody's got their hand in, and actually you can't clean in between use, and it's nice and moist, and it's just an ideal environment for things like bacteria and bugs to grow. Jazz, was there any other things you wanted to say?
I think going forward, it's really important that schools have cleaning schedules, and so making sure that people are accountable to make sure that cleaning is done. You know, if you are purchasing toys, it's making sure that they are wipeable, cleanable, or machine washable. So that's really, really important when you're purchasing any type of toy.
Right, we've got a question about exercise books. Do the teachers need to wear gloves?
So I've seen some things where actually in terms of exercise books, that rather than the teachers marking them, actually get sort of the kids to mark their own. I don't know how that would work in different settings, but that's certainly one idea that people have got, so that you're not having as many things passed between different hands. I mean, you know, there's nothing to stop people wearing gloves. It's just obviously an issue that if you've done, you know, one child's book with a pair of gloves, you're then potentially moving any sort of trace of virus from one book to another. So hence the reason that, you know, getting children, young people to sort of self-mark work might be more appropriate at the moment.
Angela, if you could provide further guidance on whether the families, within a bubble, obviously when somebody's got to isolate for 7 days, the rest of the bubble has to isolate for 14 days. Does that include their households too?
No, it doesn't. So their households will be sort of contact to the contact. So unless they become symptomatic, their household can continue on their business. But again, if we're looking at our sort of primary school age children and younger, obviously somebody's going to need to look after them. And what we don't want families to do is to think, oh, okay, little Billy's off school because somebody in his bubble's ill, let's take him to grandma to look after, because we're still trying to protect our older generations who are far more at risk of COVID. So it might be that you know, somebody else does need to stay off, but not because they're isolating, just because they need to obviously look after their child.
Somebody's requesting some guidance for pregnant ladies.
Yeah, we can certainly share that. So the initial guidance that came out for pregnant women that was sort of very, I want to say risk averse, but I think that's a good thing to always be a little bit risk averse, because the last pandemic we had was swine flu, and that affected pregnant women and new mothers very severely. The evidence is it doesn't seem to be as severe. So the guidance is that everybody in pregnancy should have a risk assessment, and particularly in sort of health and care settings, anybody who's over 28 weeks pregnant should potentially be furloughed or put off sick if they're having sort of direct patient contact. Now, in school settings, they're obviously not having patient contact, but again, it's down to a sort of individual risk assessment. If you'd got a pregnant lady who was maybe also part of the Black, Asian, minority ethnic community and maybe got underlying conditions, again, you may want to, you know, to put them off work early as opposed to keeping them in work.
We have a question about contact. Obviously, with early year settings, some children are a bit reluctant to start their day, and obviously staff members are having to obviously take the child off parents. Should they wear a face mask and gloves in this scenario?
Yeah, so we're not recommending sort of PPE outside of care and health settings as a general rule. It's only if you think somebody's symptomatic.
Right, and at the start of this presentation, you mentioned that in some circumstances, COVID-19 on surfaces for up to 9 days, depending on a number of factors, including types of surfaces and humidity. Is there any wider guidance as to which surfaces hold the virus for longer and what sort of humidity? We have used a 72-hour decontamination period for items not so easily cleaned before they move between classes or bubbles. And obviously this staff member is worried that this is not a good solution.
So the latest information that we've got is that COVID survives best on sort of clean, hard surfaces in cold environments with low humidity. So, you know, most places wouldn't be, you know, wouldn't fit that sort of criteria. But again, in terms of things that are not so easily cleaned, it's worth thinking about actually how could we potentially clean? You know, is it something with a hard surface? Is it something that could be steam cleaned or something that could be laundered? So it's worth thinking about, because again, this virus is very new. It's quite hard to sort of grow viruses in labs. So we haven't got all the answers to exactly how long it survives in the environment. We've just got some studies that have been done.
Right, okay, what about if a bubble has to self-isolate due to a case within the bubble, but have siblings in another bubble because they are in a different year group? Do they need to self-isolate too?
Okay, so if the siblings are siblings of the person who's symptomatic, then yes, because they're part of that household. If it's the rest of the bubble, then no, they don't need to, because again, they're contacts of contacts.
Right, we've got some settings which are open plan, which consist of 46 children. Can this be classed as one bubble?
So it could be, but obviously if one person within that bubble was a confirmed case, that would mean that all children and all staff would need to be off for 2 weeks. So we have had that in some settings. We've had issues where, again, people have maybe moved around between bubbles, and then actually, everybody has had to go off because there's a confirmed case. And I suppose, it's whether people want to take that risk or whether there's any way that people could be separated. But I'm absolutely aware that some settings are set up as open plan, and there's quite a lot of free flow for the children, which is great. But yeah, it would mean that if one person was a confirmed case, that everybody would have to be off.
And washing of toys at the end of each day, is that a rule or a suggestion?
I think it's yeah, I was going to say it's important because, I mean, generally to reduce the risk of cross infection of any type of infection is if equipment is cleaned daily, that would help to reduce the spread rate a lot for lots of different types of infections. Obviously, if there's an outbreak, we will be asking questions about as to what the procedures are to ensure that the risk of spreading infection is ensured in the setting. So those would be one of the questions as to how are you ensuring that. So I think that's the important thing. What you're trying to do is to reduce the risk of cross-infection by washing the toys.
We have concerns about library books that move between pupils. Obviously, they can clean the outer covers, but not the actual pages.
Yeah, and those are ones where what you might want to do is to decontaminate the outer cover, and then leave them sort of somewhere for a few days to a week or so before reusing, just to ensure that there isn't any sort of viruses on the surface, that's given them a chance to die off. But again, they're not a sort of shiny hard surface, and your schools aren't refrigerated. So, we wouldn't be looking maybe at the virus surviving as long on things like library books as we might do in some sort of industrial settings.
Right, thank you, Angela. I think that's the last of the questions. Oh, sorry, we've got another one. Oh, no. Yeah, where can I get the guidelines for pregnant women?
Oh, okay, let me just see if I can quickly find them.
I've got
various things open.
I think if you put into Google pregnant and COVID-19, they'll take you to the Royal College of Obstetricians and Gynecologists. Is that the right one, Angela?
It is.
Pregnant,
Yeah, that's the one.
That's the one to go for.
Right, I think that's all of the questions. Thank you very much.
Okay, well, I hope people have found it helpful. I know we may not have been able to cover absolutely everything, but again, if you do get a suspected or confirmed case within your school community, do give us a call or fill in select survey, because we're here to support you with managing these sorts of cases. I think it causes a lot of concern for schools and for governors and for parents, and obviously what we don't want is for people to be worried and sort of closing schools because they're so concerned. We can guide you through that, and local authority can also help with things like communications to parents.